Welcome to this masterclass. My name is Uzo Ehyog and I'm a climbing physiotherapist and a strength and conditioning specialist with Inside Edge Physiotherapy. Okay, so this class is all about tool assisted manual therapy, how to improve your climbing without actually climbing. So what we're going to be talking about during this course is how to use foam rollers, spiky balls, lacrosse balls and etc. To improve your flexibility and mobility and ultimately to improve your climbing. Now, foam rolling and tool-assisted manual therapy is quickly becoming a staple activity in many training programs worldwide. That's from elite athletes to weekend warriors. You can walk through many training facilities and you will see people on foam rollers, spiky balls, and also lacrosse balls throughout. Okay, so what's the science behind it? Well, the science at this moment is rather inconclusive. It doesn't tell us exactly how the mechanism works when we use foam rolling and tool-assisted manual therapy. However, there are numerous athletes and patients that we see who seem to get benefit from these techniques. And one of the ideas behind it is that what we do is when we apply direct pressure over a muscle, and over a tender spot, it somehow manages to activate the Golgi tendon organs, which are specialized receptors within the tendons within our bodies. Now, this causes a reflexive type response, which causes relaxation of those muscles. Because the Golgi tendon organs, effectively, what they do is they detect tension within the muscle and also the tendon. So, what we think is happening is we apply direct pressure, which is tension, through the tender spots within your muscles, and that somehow causes or may cause the Golgi tendon organs to cause the muscles to relax. And that's what we think, or that's one possible explanation for why we get muscular relaxation and we get such positive effects with this particular technique. But as I say, the science is still out in regards to exactly what is happening, and that's just one possible hypothesis. After addressing the science, people often ask me, so what are the indications for it? Or, to put it another way, when should I do it? Well, if you want to improve your mobility and range of motion, within the myofascial tissues, i.e. your muscles, then it's a good reason to do it. That will then improve the joint range of motion, around specific joints, because the muscles are intimately related to range of motion at joints. The next indication is to reduce scar tissue and adhesions. Now, interestingly enough, scar tissue is something that occurs after an injury. So if you are nursing an injury, it's important that you don't follow this course as a method, to try and sort it out. It's much better and definitely preferable that you speak to a healthcare professional. Also, it helps to reduce tone and overactive muscles. So it can be used as a great cool down after hard physical exercise. And also as well, you can use it as a bit of a gap filler, in between your hands-on sessions of deep tissue massage. So equipment is another important component of any program. So with a foam roller, virtually any muscle group can be addressed with a foam roller or also a medicine ball. When we talk about tennis balls and lacrosse balls, now they're my favourite actually, and a tennis ball is generally, or a lacrosse ball actually, is generally the smallest implement that we can use, for specific soft tissue mobilisation purposes, and it's also very convenient because you can keep it in your climbing bag, and it can address most fascial muscle groups and fascial components, that have a smaller surface area. There are also sticks as well. That's also yet another convenient tool, that can be used. They're not as popular, but again, can still be used. So like all things in therapy and also medicine, a rational approach is always critical, okay, and always the best place to go and the best step to make. So in essence, you could, okay, foam roll and soft tissue mobilize all the muscles in your body. However, you don't have an infinite amount of hours available, okay, and you want to be time efficient during your training, so you can spend more time on the wall and climbing and enjoying the things that you love doing, rather than spending it, okay, mobilizing and moving soft tissues. So, which muscles, okay, or muscle groups should take their priority? Okay, a prioritized approach that we've developed at Inside Edge is called the three coaches concept. The three coaches concept is something that we developed at Inside Edge. Okay, essentially, it's the only coaches a recreational climber will ever need. Okay, coach one is periodization and planning, which we will touch on in subsequent courses. Coach two is strength and conditioning. Again, not for discussion here. And then coach three, which is for discussion, is movement efficiency. In essence, okay, if we improve our movement efficiency, okay, be that technically moving across the wall or having the flexibility and range of motion, okay, to get ourselves into these unique and wonderful positions that we get ourselves into climbing, then what that provides is that's one of the pillars of performance optimization and also injury prevention. So with movement efficiency, it's all important to take a systematic approach. Okay, so what we look at in essence is we do a needs analysis. Okay, so we look and we say, what are the common movement patterns that climbers involve themselves in, such as the Egyptian, the drop knee, the rock over, etc. From that, which of those muscles become functionally short and tight and need to be addressed? Then we ask ourselves, what joints are frequently overused, abused, or even, for want of a better phrase, misused? Then that allows us to provide an injury profile of that particular sport, or sport climbing and bouldering, okay, which are very much the same and similar for all intensive purposes. The focus of this course is all about improving your posture as a climber. So the climber's posture, or aka the upper cross syndrome, is classically seen in bouldering and sport climbing populations, especially in climbers that have not paid due attention, okay, to their posture, to their soft tissue mobility, and also muscle imbalance, i.e. their strength. Now, our focus is really just on the soft tissue impairments that climbers with aka the upper cross syndrome display. Now you can see in the picture, okay, that I am leant forwards and I'm really exaggerating the climber's posture, but you will see various derivatives of this posture, okay, in many climbing walls and certainly down on the crag. Now, what we see essentially is we see muscle tightness in the pectoralis major muscles, the latissimus dorsi muscles, the teres major muscles, okay, and we see excessive stiffness and tightness in the spinal erector muscles at the back of the neck and the nape of the neck. And then with that we see clear muscular imbalances, i.e. a lack of strength in the middle traps, lower traps, rhomboids, okay, and associated tissues.